Hello everyone. So in this video, we are going to be talking about the introductory topics to anatomy and physiology, terms, the anatomic position, and homeostasis. Okay, so just a quick review of what anatomy and physiology is. Anatomy is the study of structure and location. Okay, and physiology is the study of function. Now, the good thing about that is sometimes the location and structure of a certain organ, a certain cell actually gives you an indication of what the actual function is. Okay, so again, anatomy is the study of structure and location, and physiology is the study of function. Okay, so one of the big things about anatomy and physiology is actually terms, and this is actually a very, very important thing. If you've taken medical terminology before, this should be a quick review for you. Okay, so this is the anatomic position. Okay, standing upright, eyes forward, palms facing forward. That's actually the anatomic position. So this is the anterior view, meaning it's facing you, and this is the posterior view. Okay, so the back side of this actual model, or this diagram in this case. All of these things that are lettered are actually in this case regions, superficial regions. Okay, A is the orbital region, B is the neck or the cervical region, the sternal region is the sternum, brachial region, femoral, patellar, popliteal, calcaneal, gluteal, olecramal, scapular, and occipital regions. Okay, so those are all regions, but all of those regions can actually be related to each other using these three main sections. So coronal or frontal section divides regions into an anterior, sometimes called ventral, and posterior relationship. Okay, a mid-sagittal section is actually, there's an imaginary line that goes right down the middle of a human person, divides regions into medial, something closer to the midline, and lateral, something further away from the midline relationship. Okay, and then we have transverse section. And the transverse section basically is if you just take sections that like chop this person this way. This is a terrible thing to say, and what that does is it divides regions into a superior, something on top, or cephalad, and inferior, sometimes called cauded relationship. Okay, there are two other special relationships. One is called distal proximal. Distal proximal only applies to the appendicular regions, which are the arms and the legs, and distal means, okay, further away from the joint. So in this case, if you're talking about the arms, it's the shoulder joint. If you're talking about the legs, it's the hip joint. Okay, and proximal means closer to the hip joint. And then obviously there's this thing called superficial and deep. Superficial is something on the surface, and deep is underneath the surface, sometimes called profundus. Okay, so how do you apply this terminologies and these sections to this diagram? Well, let's give you an example here. Okay, so if you look at A and B, the orbital region and the cervical region, we can see that A is above B. So therefore, they must be separated by the transverse section. And therefore, the orbital region then is superior to the cervical region. Okay? The opposite, the inverse is also true. We can also say that the cervical region is inferior to the orbital region. Okay? So that is one way that we can actually relate this relationship. How about, in this case, the sternal region and the scapular region? Well, one is in front and one is in the back. Therefore, the section that separates them is the coronal or frontal section. So in this case, the sternal region, D, is anterior to the scapular region, H, or the scapular region is posterior to the sternal region. Okay, so again, make sure that you understand relationships. You should be able to pick any region, and then you should be able to describe their anatomic position relative to each other. Okay, now let's look at something a little bit more confusing, which is this actual distal proximal thing. And again, it has something to do with arms and legs only. So let's look at the femoral region, which is E, and the patellar region, which is F. Which one of this is closer to the hip joint? The femoral region is closer to the hip joint. So we can actually say that the femoral region is proximal to the patellar region, or the patellar region is distal to the femoral region. Note that in all of these relationships, you have to have two regions to compare. You cannot say the sternal region is anterior. Well, what is it anterior to? Okay, so because if you think about it, okay, so the umbilical region is also anterior. So you actually have to make a specific relationship in this case. Okay. So in the previous slide, we talked about superficial regions on the surface of the actual human body. There are cavities internal, okay, or deep to those regions. There's actually holes in your body, and those are called cavities. Okay, not the cavity that's in your teeth. We actually have in this case, again, the rear is actually dorsal. The dorsal body cavity is made up of two cavities, cranial cavity and the vertebral canal. And obviously the brain and the spinal cord actually is in those two cavities. And then we have the ventral body cavity, which is made up actually in this case of three further smaller cavities, the thoracic, the abdominal, and the pelvic cavity. Okay. If you're viewing this person from the anterior aspect, you can see that in the thoracic region, okay, which is one of the most heavily protected, FYI folks, the thoracic cavity and your cranial and vertebral cavity is one of the most densely protected regions, and obviously important organs are in those regions. Of course, things are also important here, but we're going to talk about those things in the future. In the thoracic cavity, there are other cavities inside the thoracic cavity. The mediastinum, which is the region behind your sternum, is where your blood vessels and your heart rise in. And guess what the cavity where your heart actually lies in? It's called the pericardial cavity. And then you actually have the pleural cavity, and that's the space that the lungs actually occupy. One of the important things about body cavities, folks, is there's always a tissue, a connective tissue that actually in this case lines most body cavities, specifically in this case the ventral body cavity or the anterior body cavity. Okay, and if you think about it, they are actually named after the cavity that they're in here. So in this case, the membranes, the serous membranes, if you want to think about them, that's actually what they're called, actually lines all of these cavities. And the reason why they line these body cavities is that's how they reduce the stress and friction when all of these organs actually expand. You have to understand that your lungs expand, your heart expands, your stomach expands, your intestines expand. So you have to have this kind of like almost like an airbag system that prevents injuries to these organs as they expand and contract in this interior cavities, and those are called serous membranes. Okay, serous membranes, S-E-R-O-U-S. And serous membranes, folks, is a connective tissue, and it's double layer. If you want to think about it, it's actually look like this. So let's just think that it's in your pericardial cavity. It actually looks like this. It's actually a double layer. Okay, so let's say this is the heart. The heart is here. Okay, and the wall of the thoracic cavity or the pericardial cavity is here. Okay, this is two layers. Okay, this is a terrible drawing. The serous membrane that actually makes contact, okay, that makes contact with the actual organ is actually called the visceral, okay, layer. And the reason why it's called visceral layer is because viscera meaning, in this case, organ, and the one that actually is making contact with the wall of the cavity is actually called the parietal layer. Okay. All right. So again, it's going to be the same for the abdominal cavity. The membrane that actually is making contact with the organs will be called visceral. Okay. And then obviously the actual layer of the in this case the serous membrane that's making contact with the wall or the outside wall of the cavity is actually called the parietal layer. Okay. Now the abdominal pelvic regions or quadrants, this is actually the abdominal pelvic regions can actually be divided into two ways. The 9 abdominal pelvic regions and the 4 quadrants because there's 4 of them, and you just make a straight cross from the sternum all the way to the symphysis pubis, and then you go midline from the umbilical, from the belly button or the umbilical region. And if we can see, we have a right upper quadrant, left upper quadrant, right lower quadrant, and the left lower quadrant. Or you can divide them into this much more fancy 9 way, and that's called the hypochondriac region. Hypochondriac, hypo meaning below, chondriac meaning ribs, epigastric meaning above the stomach, lumbar because that's your lumbar region, the umbilical region, that's where your belly button is, hypogastric meaning below the stomach, iliac region, and that's because the bone that actually is in this region is actually called the iliac bone. So those are actually 2 different ways that you can actually divide the abdominal pelvic cavity. FYI, this is actually the way that medical professionals do, like in this case history or a medical exam. They actually have a technique. They'll say, oh, there's a pain in the left lumbar region, there's a pain in the right hypochondriac region, or inversely speaking, there's a pain in the right upper quadrant. Okay, so as you can see, the liver is here, stomach on this other side would be your pancreas and your spleen, and the green thing here, the green tip, is the gallbladder. You have your large intestine here, and then all of this swirly things is your small intestine, and that's your urinary bladder. And now we're off to homeostasis. Okay, so homeostasis, the term homeo means body, okay, or the whole body, okay, homo erectus, whatever, and stasis, if you think about it, static means stay still. All right, so these variables have to remain, and now we're not talking about a single number, but most of them are within a range. So in this case, we know that the normal body temperature is 98.6 degrees Fahrenheit or 37 degrees Celsius. Blood glucose is between 80 to 110 milligrams per deciliter. Blood pressure is between 90 systolic, 60 diastolic. There's the range again. And FYI, those are called homeostatic variables. Now, why are they homeostatic variables? And there is this thing called feedback mechanisms. Okay, so I'm going to talk about that in the next slide. So in a homeostatic control mechanism, there is stimulus. Now remember, one of the characteristics of life is to be able to respond to stimulus. Okay, so there's a stimulus, whether that's a pain, okay, your blood pressure went too low, okay, so your blood sugar is too high, okay, so that's a stimulus, and a receptor detects the change. And that is many things, and most of the time your receptor and control center is in the purview of your nervous system. Okay, so sensory receptors can detect that, the hypothalamus perchance. Okay, and what happens, folks, is the brain, okay, the control centers of your body, and your endocrine gland, okay, the other control center of your body, then determines what it needs to do, and then it says, it then delegates the response to an effector, and what happens then is the homeostasis is restored. So let's say your blood pressure goes too low. Well, if it goes too low, in this case, perhaps the homeostasis means, as you guys can see, this little thing here is, it goes back to normal, which is this black area here. So that is the order of a homeostatic control mechanism. You have a stimulus, you have a receptor, you have a control center, okay, you have an effector, and then hopefully the homeostasis is restored. So when you can no longer maintain homeostasis, that is when people die. So this is a negative feedback homeostatic mechanism, and the reason it's called negative feedback, folks, is it always goes the opposite way of the stimulus. So your body temperature is too high in this case, so the sensory receptors in your skin can detect that, so your temperature has gone above 98.6. The hypothalamus then says, oh, that's not good, I need to cool down, and so sweating occurs, and sweating then cools you down, and hopefully sweating then returns you back to 98.6 degrees. So again, if you go above, you go the opposite way of that stimulus, that is called a negative feedback homeostatic mechanism. The other example is called a positive feedback loop. And positive feedback means like you go left, you keep going further left. So the suckling of breast milk is actually a positive feedback loop. As more milk is suckled, more milk is